Pregnant women should get the COVID-19 vaccine, and that is the most recent recommendation by the Centers for Disease Control and Prevention, or CDC. The CDC now saying that pregnant people are with COVID-19, that is, are at an increased risk of preterm birth and other pregnancy complications. So what are doctors seeing here locally? Our Maria Salazar taking a look at that.
Dr. Kirsty Agard, who specializes in obstetrics, gynecology, and maternal fetal medicine, says it's too early to tell if the Delta variant is causing more complications in pregnant women than previous strains of COVID-19. But she says this is what she does know.
Our hospitals are full to the brim, and we've got all kinds of preventable sick people, including pregnant women and their young children.
Pregnant women with COVID-19 are more likely to become severely ill, and their babies are more likely to be born preterm. On Wednesday, the CDC recommended women who are pregnant, who may become pregnant, or breastfeeding get the vaccine to prevent severe illness. Dr. Agard says she has seen some breakthrough cases. Most are mild.
They don't get as sick, and they don't end up in the ICU, and their babies survive.
The ones in the hospital are largely unvaccinated.
I think a lot of the time it originates from misinformation or fear. And that really breaks my heart.
She says the vaccine is safe for pregnant women at any stage in their pregnancy. She says there's no evidence it will cause miscarriage, pointing to a study published in the New England Journal of Medicine that looked at about 2,500 pregnant women who got the vaccine.
And they found there was no increased risk of miscarriage. In fact, there was a slight decreased risk relative to those who didn't get the vaccine.
She says it's also biologically impossible for the mRNA vaccine to cause infertility.
We have zero evidence of problems with infertility in animal models. We have no evidence in early human studies of any relationship to infertility.
Dr. Agard says a pregnant woman getting the vaccine can actually help protect the baby from COVID-19.
Antibodies are being transferred that can either neutralize the virus or can ward off the virus.
As for side effects, she says pregnant women are not any more likely to have them than women who are not pregnant. Maria Salazar, Fox 26 News.